colloquium on Sustainable Development Goal number 3. Our correspondent John Felix has details in this report presented from our studios.
The Medical Director, Federal Medical Center, Abeokuta, Professor Adewale Musa, said the health sector has been suffering due to incessant strikes, lack of adequate baseline data to plan, and insecurity. On ways the government can achieve the SDG 3 goals, Professor Musa urges government to encourage universal health coverage of all citizens, introduce community-based health insurance, full integration of all health services, and adequate training and retraining of all cadres of health workers.
We are grossly deficient. Even with ordinary medical officer, you can't get it in the rural places. So who are the people that are serving these people? They produce the food we eat, and yet we are not taking care of their health. But if you have massive training of resident doctors, they become specialists. Now you take them to all these places, rural centers, start the roads, make internet facility available, housing, security. Once all these things are available, people will be encouraged and be willing to stay there.
On his part, the Commissioner for Health, Ogun State, Dr. Babatunde Ikpaye, said it was time to benchmark leadership in the health sector according to performance and productivity. He noted that the SDG 3 could not exist in isolation, but should integrate other components such as hunger, poverty, water, and environment.
If you look at the population like Rwanda, more than 70% of people are on social health insurance scheme. So it does not matter whether you are poor or rich. You are protected at the point of service consumption. If you go to Kenya, over 60% of the population compared to less than 4% in Nigeria. Okay, so if you have a national health insurance scheme that has been run for close to 20 years, that is delivering health insurance to less than 4% of the population, then you are not targeting those who are very vulnerable. And please note, those who are benefiting from the Nigerian National Health Insurance Scheme today are those who have capacity to pay. They are the public servants.
The Director, Center for Human Security and Dialogue, OOPL, Professor Peter Okebukola, says the objectives of the colloquium is to highlight the expectation of the global community on SDG number 3 and report current realities in health security in Nigeria in relation to the attainment of SDG 3.
Where we are in Nigeria, look at what the global community expects of us. Look at the gaps. In other words, we're doing gap analysis. And then seeing what the issues are, what the challenges are. And I tell you something, everybody in the health sector today, not necessarily absolute, know what the challenges are.
The colloquium on Sustainable Development Goal number 3 was organized by Center for Human Security and Dialogue, Olusegun Obasanjo Presidential Library, Abeokuta.
Meanwhile,